Sarah. Welcome to Practical Healthy Living. Before we get into you telling us about Aspen, can you share with our audience a little bit about you? Are you from Indiana? Where did you go to school?
Yes, thank you. Yes, I've always lived in Indiana, born and raised here. I went to school, elementary and high school, about 20 minutes away from where I live now. So I've always been in this area of Indiana. I went to college in Richmond, which is also close by, to Ivy Tech and then IU East. So I graduated from IU East with my bachelor's of applied science and healthcare administration.
What is your background and what are your passions?
I've mostly worked in offices. So I've worked at the front desk of a nonprofit for about 7 years before this, and always just kind of worked in the customer service area. And I went back to school about 6 years ago to finish that degree, the healthcare administration degree. Right when I got done with school, I was looking for jobs and I saw the Aspen posting where I am now. So I was so excited about it. Didn't think I would get the job. It looked perfect and I did get hired. So I have been here ever since. So I've always worked with people in all of my jobs, kind of the helping role. But this is my first job, or more professional job maybe than the last ones, but I've always worked in offices, administrative work, that kind of thing.
Now, helping people get health insurance is such an important and noble role. Have you always been the person to help others, or is this kind of a new stage in your life for insurance?
For insurance, it is a newer stage. I was interested in medical billing and coding a while back, so I kind of got into the insurance area, but not really work. It never was my career. So yeah. Like I said, when I was in school, we took some different classes on insurance, and I learned about Medicaid, Marketplace, Medicare, and it just seemed really interesting. Some people may not think that's interesting, but it seemed interesting to me. Everyone needs health insurance. It's such an important part of staying healthy in our healthcare. So yeah, it's kind of a newer role for me the past 5 or 6 years. Yes.
Well, what is one thing that makes you smile about the work that you do now? What gets you out of bed in the morning and eager to come into work?
Well, we work with so many different locations. We work with jails, probation. We go to homeowners association meetings. We go everywhere, shelters, and I just really enjoy being able to help different people. I talk to different people all the time. Some people that are really down on their luck, maybe in addiction, and they're maybe in a shelter and don't have anything, don't have insurance, can't get into any rehab programs, to the doctor. That's really fulfilling, being able to go and help those people, give them, let them know there is actually free assistance if your income's low. So I really enjoy helping in that area. And we go to a lot of community mental health centers. All of our navigators have different centers around them. So we all go to our centers in our areas to help those clients get on insurance so they can get in the counseling or the therapy that they need. So I really enjoy that. And whenever I talk to people, they're just so happy that we were able to help them. So, and I don't always do a lot, but I feel like I'm there. I'm an ear to listen, and I can help them, get to the doctor, get their medicine. So, help them with the insurance, but I can help tell them how to do all that. So that, I really enjoy that. And we help small businesses even that maybe they can't offer insurance for their employees. So we can go in and talk to the business owner about maybe they can provide a stipend for all of their employees, and we can help each employee with a marketplace plan. So I just really enjoy being able to talk to all the different kinds of people, and everyone I talk to are always so just so grateful for our help. And it just makes me feel good to be able to help people every day.
Sounds like very creative work that you're doing.
Yes. That is, we've just hired some new people, and that's part of it. They're like, where should I go out to hang our flyers and do marketing to let people know we're here? And we're just like, anywhere and everywhere. I've been to bowling alleys and set a table up before at one of the bowling alleys events around here. Different healthcare organizations. And like I said, different mental health locations. apartment complexes, they have community rooms. So we'll maybe set up there sometimes. The housing authority, just anywhere and everywhere. So that is part of the job. When some of our new people started, they were like, wow, this is a little different than I thought, because we help with insurance, but we also have to get the word out that we're here to help. So we have a website and we have flyers that we put up a lot, but a lot of it is just making the connections, going to all these different locations and letting organizations know we're here. They can refer people to us to help them. So yes, a lot of creativity also in our job. Yeah.
For the past 18 months, we've kind of had to deal with COVID in our day-to-day lives. How has COVID impacted what you do, and how have you addressed that?
Well, it's been kind of easier for us. We were piloting a more virtual program before the pandemic, so we could reach people statewide more easily, because we only have so many navigators, so we don't have someone in every county. So it was hard to reach people maybe in the far corners of the state. So before the pandemic even hit, we were starting to use Zoom and Skype back then to have virtual appointments. So the transition for us was actually a very easy one compared to what many organizations probably went through when the pandemic hit. And we've always been called, we're mobile navigators. So our office is at our home. We don't meet people at home. We go out to meet people, but we've always been mobile, and work from home. So that was a good transition for us. Nobody had to go to the office to work every day anyway. So, but yeah, we started using Zoom and Skype before the pandemic, and then afterwards we've got onto Teams now. So we have a lot of appointments each week now through Zoom or Teams set up. So the pandemic just kind of helped our virtual model become more successful. Now we can help anyone, anywhere, more easily, anywhere, throughout the state. And we're also starting to do things out in the community again now, remembering to use the CDC guidelines. But yeah, it changed just because no going out in person at all, at the last year. But yeah, we'd already started doing some Zoom things. We were already working from home. So it really worked out good for us. And we were able to just reach a lot more people. There were a lot of people with COVID that were sick that needed help. And so it was so easy. We could just talk to everyone through Zoom or even on the telephone. If they don't have a computer, we can do phone appointments, which we didn't do that so much before the pandemic. So we changed how we did things a little bit. Like I said, we were already in the process of that. So yeah, it's worked out really good for us, actually.
You were very fortunate that you were already headed in that direction.
Yes, we were doing a program, some diabetes education support groups back right before the pandemic started, and we went in person to meet. We had a few groups. I had a couple in my area. Some of the other people had some in the other parts of the state. And yeah, that was one of the first things. We switched virtual and we started doing our support group virtually, and it worked out so good. And yeah, since then, everything's been really good through Zoom or Teams virtually. Yes.
Let me ask you a hypothetical question, and this is a question that's actually based on a personal experience. I was living in Wyoming, and I had an art gallery and a new private practice, and things were going along just really well. But then, boom, all of a sudden the bottom fell out, came 2020, and the pandemic hit. And I was without health insurance all of a sudden. And everything was based on my past income, even though my income just ceased to exist. And I had to move across the United States, which took my discretionary income. How would you help someone through that process now if they came to you with a similar scenario?
Okay, so if you're in Indiana, because Medicaid is different from state to state, but if you had just moved here, I would probably first, if you had no income, Medicaid goes off your past 30 days of income. So if someone's just lost a job, there's a good chance they could qualify for the Indiana Medicaid. It's called HIP, or the Healthy Indiana Plan. So a lot of people don't realize that either. And so there was a good chance you may have even been able to qualify for that for a while. And then when your income goes back up, switch to Marketplace. But if we didn't look at Medicaid, I would first help the person get on the Marketplace website. There is a tool you can type in your income, zip code, tax household size, and age, and bring up the plans and prices. So that's what I'd probably do with the person first and kind of go over the plan, see if there is anything affordable. And it should be based on, for Marketplace, is based on your income for the following year. So for like, it's open enrollment right now through January 15th is open enrollment for Marketplace now. And so people now, like I helped someone today and they were trying to figure their income, but they were going off this year, but really it will be off next year's income, which also is really hard for people to estimate a lot of times. So that's something we kind of help people with too, trying to estimate their next year's income. But so that's one thing, it would go off next year's, not now. And yeah, and prices do vary by zip code. Some cities seem to have more plans and they're lower priced and more competition, more companies, and other counties and in Indiana anyway, probably everywhere, but just have like just a couple insurance companies. The prices can really vary by your zip code, the area you live in, your age, that kind of thing. So yeah, I would try to go over the options with the person. And like I said, some people don't realize that there's a good chance they may qualify for the free Medicaid insurance in Indiana because it just goes off your past 30 days. So yeah.
See, I wish that I had met you earlier.
I know. I wish so. Hopefully some people will be listening and yeah, they might give us a call and realize that. Yeah.
I think when people think of Aspen or you helping them with Affordable Care Act insurance, they think that you only work with destitute people. And I'm thinking that you actually work with a broad range of people. Is that accurate?
Yes. And that's part of the creativity we talked about earlier. That is part of that, trying to reach everyone everywhere, because everyone needs insurance assistance, or a lot of people. I mean, if you're offered it at your job, then that's pretty much what you should usually take. But a lot of, if you are offered employer insurance, then yeah, you could call us because yeah, any income level, we help with Marketplace, the higher income levels, all the way down to no income. So yes, and it's kind of hard to reach out to let people know we are here. Like I said, we can go to shelters and different places for low income. But it's kind of harder to find people, let Marketplace income people know we're available. So we're trying to do things like this. And like I said, we have our website, we post on Facebook, we go hang flyers up different places. But yes, we help a wide variety of people and income levels. Yes.
Sarah, we have to take a break here, but okay. We will return in about 60 seconds and I'd like to hear more about Aspen.
Okay, thank you.
Welcome back. Today we're talking to Sara Lewis about her work with Aspen and helping people get insurance, health insurance. Sara, can you tell us about Aspen? What is the organization and what do you do?
Well, Aspen has been around since 1995, so we are at our 26-year mark now, and we have been doing our Health Navigator grant, which is what I am, a health navigator, the grants from CMS, and we've been doing that since 2013 with the rollout of the Affordable Care Act. So that's when we started or got the grant to start our Health Navigator program. And Aspen stands for Affiliated Service Providers of Indiana. We're a network of behavioral health providers. So we work closely with Centerstone, Bowen Center, Hamilton Center, Valley Oaks, and others, mental health centers across the state. And we first got this grant because there were a lot of consumers that were uninsured who came into the community mental health centers. So we went in to help their clients get insurance so they could get the services they need. So that's what how we kind of got started, or what the grant was started for, to help those consumers at those organizations. And so that's the areas we first worked at, the community mental health centers. And since then, as we've talked about earlier, now we go everywhere, to jails, probations, other organizations like we discussed earlier, but we do still do a lot of assistance at our community mental health centers in our areas. And the main parts of our job as health navigators are enrollments. We have goals each week to get so many enrollments or help so many people, and then providing education in the community. And we do that by we set up tables at different events, at resource fairs, to try to hand out information on Medicaid and Marketplace, to let people know we're here and what options are available to them. And we also do a lot of referrals to other organizations. We do webinars, and we do presentations for staff at different organizations, for staff or for their clients, on all kinds of different topics, using your health insurance, preventive care, different topics like that. So we do a lot of education in the community also, along with insurance applications and helping people get insurance. And so all those different things are what kind of makes our job so fulfilling. We do a lot of different things in the community.
All in a day's work.
Yes. Yes, it gets busy.
I'm licensed in 5 different states, and I travel around doing consultations in various states. And this is a unique program. I haven't heard of this in other states. Are you familiar with sister programs in other states that you might network with, or is this fairly unique to Indiana?
I think a lot of states have health navigators. I don't know if they all do, and if they're exactly the same as us, but I do know there are some organizations in Ohio across the line. We've had some people that are right on the line, but in Ohio, and I know I've looked up some information once, so I know there are some navigator organizations in Ohio and in Illinois. So I don't know if there's any just maybe like us, or kind of how we work, but there are some organizations I know that at least help with Medicaid, and some that help with Marketplace also. But yeah, I'm not for sure. So I should know that. Not for sure if it's every state has health navigators, but I do know a lot of them do. Yes.
You mentioned that you put up flyers and you post things on Facebook. How do people find Aspen to benefit from your services?
They can. Well, I'm going to say our phone number really quick too. If anybody would be listening, our toll-free number is 877-313-7215. So they can always call us. We have a call center with a couple people that answer any calls that come in. And whenever someone calls us, we ask them what county you're in. And then the call will get referred to the navigator that's in that county or nearest to that county. So we get calls a lot. Also, we're on Facebook. If you look up Aspen Health Navigators, ASPIN Health Navigators, you can find us on Facebook. We're on Twitter, Aspen Health Navigators also. And then we have a website, aspenhealthnavigator.org. It's kind of long, but ASPIN, aspenhealthnavigator.org is our website. So they can reach us any one of those ways. Also, the Indiana Department of Insurance has a spot if people are looking for health navigators. Not probably a lot of people go to the Department of Insurance website, but some may. They could find us on there. We would pop up under, insurance assistants or navigators, and the Marketplace website, the healthcare.gov website for Marketplace. There's a spot on there also. Like if you're looking for assistance, and you can type in your zip code, and we should pop up on the Marketplace website also. So there's a few different ways people can find us or get referred to us from like the Marketplace website.
Now, if someone goes to a community mental health center and they're kind of stressed out, they don't know where to turn. You mentioned also that oftentimes you get referrals from the community mental health centers.
Yes. And we all try to keep in close contact with like the front desk staff and some other staff, but the front desk staff especially, they're the first ones that meet clients that come in, to let them know if you get anyone that doesn't have insurance or has questions or problems with their insurance, please give us a call. So we try to keep in close contact with all the front desk staff at all the centers in our areas. So they'll notice and send people to us. And we leave our flyers and information there also, so people can take it, or family members that are there. Maybe they may need assistance and they can take our flyer to give us a call later. So, yeah.
What other things would you like people to know about your work at Aspen?
Just that if you don't have insurance, or maybe your kids don't have insurance, there are a lot of options. And one thing I've seen is a lot of people don't have their kids insured, but Medicaid for adults, the income level is lower. So adults may not qualify if they're working, but a lot of times their kids do. The income limit's a lot higher for kids. So I would say one thing is, if you have kids, maybe give us a call. Maybe your kids may qualify for the free or the really low cost Medicaid coverage for kids. Also, pregnant women in Indiana can make, it's a little over $3,000 a month to get Medicaid. So it's higher than regular adults. So I think a lot of people probably don't realize they would qualify for Medicaid. And then for Marketplace also, if you're not offered work insurance and you make too much for Medicaid, there may be an affordable option. So we could help you look at the options for you. So just to let people know that they can call us, and we are here to kind of help them navigate the health insurance system.
Now, you mentioned that Medicaid is based on adults' income. What if you have one adult that works and one adult that doesn't work?
Well, it just goes by tax household size. So if they're married, they're going to put the two married couples' incomes together, so however you file taxes. So if two people just live together that don't file taxes, related or not, they're separate.
And what if they file separately?
Give us a call and we'll check that one out. Okay. It's pretty much in the same household and you file taxes together. If you live in different households and you would file separately, we'll take a look at it to make sure. I don't want to say anything wrong, but yeah.
Fantastic. The work that you do is so important. And every once in a while, I get to talk to someone and share a story on PHL about something that is just a really good program. And I want to thank you for coming on today and talking about this.
Thank you so much for having us. Thank you.